Welcome to Medlock Holmes, Medical Melodies, Mindful Medicine. This is where medicine meets mystery, one clue at a time. Medlock Holmes was born from a moment of uncertainty, a gap between finishing school and starting medical training. For our founder, Mahika Ray, that gap was filled with questions. What does medical school actually feel like? How do I prepare for problem-based learning? Am I really ready? Rather than wait for answers, she went looking for them, and what she found became Medlock Holmes, a detective-themed educational platform that helps aspiring medical students build clinical reasoning, case-solving skills, and confidence long before they enter a lecture hall. So Medlock Holmes began as the kind of resource Mahi wished she had: fun, interactive, medically rich, and rooted in real student experience. With contributions from mentors, collaborators, and fellow students, it has grown into a community and a toolkit rolled into one. For high school students, it's a way to explore and get excited about the path ahead. For gap year learners, it's a bridge of confidence into medical school. For parents, it's a way to support their journey and see their children thrive. At its heart, Medlock Holmes is about turning medical education into a mystery worth investigating, combining empathy, curiosity, and clarity with the detective's instinct for detail. Let me introduce you to the crew who you will find on this YouTube channel. So, stepping out of textbooks into the beats, this is the crew behind the bones and the bars. First comes Hip-Lock.
Names are power, and power is memory. When the brain remembers, the body moves freely. So here we begin, from pelvis to toe, chant of the muscles in rhythmic flow.
She is the rhyme slinger of structure. She knows the groove of every groove, from the acetabulum to the zygomatic arch. With poetic flair and photographic memory, she transforms complex anatomy into flowing verses that stick. Then there is Hip-Lock.
Yo, from the back of the humerus, let me break it down. 3 heads of the triceps hold the power crown. Long head flexing from the scapula's edge, while lateral rides high and medial keeps the pledge. From shoulder to elbow, the movement's clean. Old cranial target, posterior sheen. Anchor nearby, a small backup knife, stabilizing the joint, holding it tight.
The beat-bound biologist. Don't be fooled by the laid-back hack tilt. He maps every nerve like a cartographer, flips physiology into rhythm, and makes learning medicine feel like vibing to your favorite track. And then there are the teachers like Analock Holmes, the keeper of anatomical secrets.
The pelvis is a gateway, a basin of strength and birth. Step in, detectives. Let's map the bones of your foundation.
A legendary anatomist and mentor, once a surgeon, now a professor. With chalk-dusted tweed and an eye sharper than a scalpel, Analock teaches with mystery, reverence, and flair. Together, Hip-Lock, Hip-Lock, and in this anatomy series, Analock make learning medicine not only possible, but memorable, lyrical, and alive. So let's talk a little bit about the 4 albums that we have released so far, and there are a number of them, others that are coming up and in the pipeline. First is Infex, The Ground Beneath Us. Let's have a listen.
Adductors pulling your leg to the line. Longus, brevis, magnus align. Gracilis rides the inner thigh. Obturator externa standing by. Together they bring the limb back tight, pulling in words with graceful might.
So the journey begins at the base, the lower limb. 15 tracks that take you through the pelvis, femur, knee, ankle, and foot. From the sculpted bones that bear weight to the joints that glide, to the muscles that launch every step, Infex is the anatomy of motion turned into rhyme. It's perfect for physiotherapy, sports science, and anyone learning the foundations of human movement. But most of all, for medical students, nursing students, it is absolute gold dust. Then comes Supex, Anatomy of Motion. This is the upper limb. A number of tracks, the marvel of dexterity.
Start at the top with the clavicle line. Bridge to the trunk, hold the shoulder in time. Sternal to acromile, slender and sly. It's the strut of support as your arms reach high. Back it up now. Scapulas glide, got a spine in the Crimean. Wing on the side, coracoids the hook. Glenoids the cup, where the humerus fits. Now lift it up.
Bones don't move, but they make the way.
So the shoulder stability, the elbows leverage, the wrist precision, and the hands mastery. Supex captures the neurovascular networks that fuel expression and fine motor control. For surgeons, therapists, and students, this is where function meets flair, where anatomy meets artistry. And then there is HEADNEX.
CN5, that trigeminal king. 3 big branches got sensory bling. Ophthalmics, top, maxillary mid. Mandibular moves the chewing lid. CN7, the facial flex. Expressions, tears, and a quarter reflex. It wiggles the brow, it puckers the lips. Bell's palsy drops it. Crooked smile rips thin. CN9, glossopharyngeal beat. Taste posterior tongue, makes parotid secrete. CN10 is the vagus vibe. Parasympathetic, gut to tribe.
This is the anatomy of the senses, the dense, complex world of the head and neck. A number of tracks unravel cranial bones, facial muscles, cervical vertebrae, vocal cords, salivary glands. This is the soundtrack of speech, expression, and sensation. So for dentists, ENT specialists to neurologists, HEADNEX shines a lyrical light on the subtle anatomy that defines identity itself. And the fourth one in this series is THORAB.
Yo, we stepping in the thorax, rhythm in the chest. 4 chambers deep where the pulse don't rest. Valves swing open, vessels in the zone. Let's chart the journey where the blood is flown. Yeah.
This is the anatomy of vitality. So we open the ribcage to find life itself. Tracks here explore the shield of the ribs, the diaphragm's dance, the lung song, the heart's relentless beat, and the gut's hidden labor. This is the music of physiology itself: breath, circulation, digestion. For medicine and surgery, THORAB makes internal life unforgettable. Looking ahead, this is just the beginning. Anatomy is the foundation, but Hip-Lock and Hop-Lock won't stop here. More teachers are waiting in the wings. Masters of physiology, pathology, biochemistry, medicine, and surgery. Each will bring their own beat, their own case files, their own rhythm of learning. Every system will find its song. Every song will have its soundtrack. So step into the lab, the beat is pulsing, the clues are glowing, the body is waiting to be decoded. So subscribe now to join the journey, from rhyme to recall, from mystery to mastery, from Medlock to medicine. So once again, welcome to Medlock Holmes. The case of medical learning is officially open.
We bring the blow.
Long head crosses to shoulder in the hinge. Gives that uppercut a rotational tinge. Laterals broad from the humerus wide, while medial digs low, stays close to the side. Blood rises deep via the bronchial lane, while the nerve in the groove makes the motion sustain. Spiral grooves the track, radial's the line. Lose it there, and you lose that prime.
Long head, lateral, medial, boom. Pushing from the back, clearing out the room. Radial flow, got the nerve on the go. With the triceps trio, we bring the blow.
Yo, picture a fall with the elbow bent back. Hear that pop, might be a tendon crack. Posterior pain, that triceps might cry. Or maybe sud is where the pressure lies. Mid-shaft fracture, watch the groove. Radial nerves at risk, can't afford to lose. Wrist drops low, grip feels weak. Extension gone, function bleak in the lag.
3 heads, 1 goal, extension clean. But break the groove and you lose the machine. In the lab, in the ring, or at rehab bench. Posterior power keeps the world in clench. Long head, lateral, medial, boom. Pushing from the back, clearing out the room. Radial flow, got the nerve on the go. With the triceps trio, we bring the blow. Long head, lateral, medial, boom. Pushing from the back, clearing out the room. Radial flow, got the nerve on the go. With the triceps trio, we bring the blow.
Posterior pressure, delivered with precision. Now flex that knowledge. Case closed.
Triceps, not just a muscle, a motus.